The Smile guy was collecting money on the drag for the People's Free Clinic. The free clinic was in a basement of a church, just catty corner from the mural site. And a lot of people were always waiting outside of the clinic to get in.
The clinic met at night from like 5 to 11 or so. Most of our patients were young.
We saw whoever walked in the door if we were capable. And these are people who would go to Brackenridge emergency room for an earache because they had no doctor. So the hospitals in town were thrilled to have a clinic with certified medical practitioners.
Also, we provided women's health care, seeing women for their annual exams, breast exams, pap smears.
What we were offering was care that should have been available to everyone, but really wasn't available at the time.
There was some kind of attitude and philosophy of love and commitment, compassion and passion. This is where people checked in. And they would come here and be given paperwork.
It took a team. We had a front staff, we had counselors, we had the physicians and the nurse practitioners.
We didn't wear any medical uniforms. I mean, we had clean clothes and everything.
No dress codes. I have to remind people that there was no air conditioning and we were in the basement of a church. And not having a shirt wasn't seen as a faux pas, it was just seen as survival.
Oh, there was one doctor, I wish we could find him. John Durfer used to come with a parrot on his shoulder.
Patients would walk in, there was a cigar box, and patients who had anything in their pocket and they wanted to pay, they paid. If it was a quarter, they put in a quarter. If it was $1, they put in $1.
People would walk in and say, everything's free, right?
Well, no, it wasn't ever free in the sense that it was just given away. We did always ask that people make a donation. I have a really distinct memory of a meeting we had of the board of directors, and the federal government wouldn't fund something that was offered for free.
So we changed the name to People's Community Clinic, and we explained to them that everybody in the place except for the doctors were paid the same thing.
So the CEO and the janitor, who happened to be husband and wife, got paid the same amount. Don't ask me what that was.
This is the church parlor that they would use on Sundays for coffee and so forth. Right here, people on the floor, we had small groups for Lamaze, which is a childbirth education, which included the father.
We were providing a care to women and health education that they were not getting elsewhere. The UT campus clinic did not provide family planning services to unmarried women.
One of the students, she said, let's put it this way. We came there to get the kinds of services that we didn't want our parents to know that we were needing.
There was a lot of mystery around women's health, but people who were delivering care at People's Community Clinic saw themselves as real educators.
I was a birth control counseling coordinator, and my role was really teaching young women as volunteers to teach women about sexual health and about contraception.
We wanted knowledge, and we didn't want it just to exist within medicine. We wanted it as women.
And it was the 60s, and it was the summer of love, and it was the introduction of the birth control pill. All of these things were coming together at the same time, and People's was kind of at the forefront of that care in Austin, Texas.
It was the age of rebellion, I'll tell you that.
And I've even heard that People's Free Clinic operated the medical tent at the Willie Nelson concerts back in the day.
We set up a tent, brought in all the gurneys, everything that we needed. We could handle heat stroke, drug problems, psilocybin trips, and that kind of thing. We survived it, yeah. Anyway, we feel like we lived a great time.
It was just the time we were living in. I don't know that we realized it was special. There were lots of threads of social activism taking place. I think we all felt empowered to do something, to contribute in some way.
And I just hope that we preserved enough of that, the fact that the People's Clinic still goes on and offers the same type of care.
The original mission is absolutely still part of the cause. It's the common thread that has run from 1970 through today. And that's taking care of those in our community who need it most, with dignity, with respect, and regardless of folks' ability to pay. And that's still who we are to our core today.
The great thing to me about People's is that People's never lost its way. I think we continue to try to live up to the vision of the folks that founded the clinic.
I find it so inspiring that people saw a need in their community, and it's one thing to feel a need and to empathize with that need, but it's something totally different to stand up and answer that call. And the fact that they started in the church basement, doing something that they just wanted to do good in the world, and a legacy that they started is truly inspirational. Today, People's Community Clinic cares for over 22,000 unique individuals. We have over 300 staff members and about 40 practitioners. We provide pediatrics, women's health, adult medicine, and an adolescent and young adult unit that is one of a kind in Central Texas.
I do think that the People's Community Clinic was maybe one of the most significant accomplishments that came out of that period of time in Austin in the 1970s. Maybe I'll allow that Willie Nelson is at least equal to the People's Community Clinic.